I'm Julie Brookhart, and I work for the Centers for Medicare and Medicaid Services out of the Kansas City Regional Office. That's the federal agency that's under the Department of Health and Human Services. And then we administer Medicare and Medicaid. We administer the Children's Health Insurance Program. And most recently, we are the lead agency, the lead federal agency that's responsible for many of the provisions in the Affordable Care Act. This presentation is going to focus on the consumer provisions in the Affordable Care Act law, those that are in place already and those that are coming up, and basically how it impacts all Americans. And when I talk about the Affordable Care Act, this is the law that is known to most as health care reform. It's also known as Obamacare. Why did we need the new health care law? What was the reason for the new health care law? And the answer is that we had a health insurance marketplace that worked very well for big health insurance companies, but did not work very well for American families. Insurers could pick and choose who they wanted to cover. Premiums were skyrocketing, pretty much out of control. But insurance companies were still making good profits. Tens of millions of people were stuck with health insurance that didn't cover critical treatments and preventive care. And also, many of those who did have health insurance really couldn't understand all their benefits and what was covered. And as well, they might have been afraid if their employer dropped their health insurance, what were they going to do? I mean, what were their options? Then there really wasn't another option but to hurry and find another job that offered health insurance. And then there was this gap of people may retire early before your Medicare kicks in at the age of 65. The health care law was passed in March of 2010. On March 23rd, the first part of the act was enacted, and that's the Patient Protection and Affordable Care Act. And then just 7 days later, the Health Care and Education Reconciliation Act was passed on March 30th. Now together, these two laws are known as the Affordable Care Act. And they were created to bring many new rights and consumer protections to everyone in respect to private health insurance. So the law was implemented in basically two phases. Just 6 months later, after March of 2010, in September of 2010, the first provisions were implemented for consumers to take advantage of, and I'll mention a few of those as I go along. The majority of the rollouts are scheduled to happen in the year 2014. So what does the law mean for you? It ends insurance company abuses, it makes health insurance more affordable, it strengthens the Medicare program, and it provides better health options or better coverage options for your needs. First key improvement area is the law stops insurance companies from taking advantage of you. Before, the Affordable Care Act, insurance companies could deny children coverage to children who had pre-existing conditions they were born with or they acquired, such as asthma or diabetes or birth defect. They could exclude coverage to a child. But because of the law, insurance companies can no longer deny coverage to children under the age of 19 due to a pre-existing condition. And that went into effect on September 23rd, 2010. So it was one of the very first provisions that went into place. Now also, before the Affordable Care Act law, the insurance companies could also put a lifetime cap on the amount of care that they paid on your behalf. Companies are prohibited from imposing lifetime dollar limits on essential benefits like hospital stays. In the past, insurance companies could also search for an error on your insurance company application and use this error to deny payment for services or cancel your coverage if you got sick. Provisions that are in the law are you can have access to an independent appeals process if you are appealing a decision by your insurance company. Insurers cannot charge an extra copay if you have to go to an out-of-network emergency room in an emergency. Annual limits to your coverage are being phased out and will be banned in the year 2014. Another provision is you can choose your own primary care physician in your insurance network, and you can go see a pediatrician or an OBGYN without a referral. Every insurance plan are prohibited from applying the lifetime dollar limits to your key health benefits, and it includes hospital stays. So it does not matter if they're a plan that was around before the health care law went into effect. They are not permitted to cancel your insurance or rescind your coverage if there is an error, an honest error on your application. And they all must cover dependent adults up to the age of 26 on their health insurance. Consumer protections apply in new plans. And there are some health insurance plans that are grandfathered from some of the provisions that are in the ACA law. The law was written to say that any existing health insurance plan that existed before March 23rd, 2010, so that was before the law was enacted, would be exempt from some of the consumer provisions. And this was to preserve the consumer's right to have the same plan that they enrolled in before the law passed. Now the health care law ensures that you get a fair dollar value for your premium by creating the new 80-20 rule. The insurance companies have to spend 80 or 85% of your premium dollar on health insurance benefits or ways that they're improving care on your behalf. And that's for small businesses, and it's 85%, for large insurance plans.